Hello everyone. Today's topic is not just a medical condition, but it is a topic of social concern and parental challenging issue. And this topic is autism, or also known as autistic spectrum disorder. It is one of the neurodevelopmental disorder. And autism is no more a rare disease because the prevalence of this condition is rising a lot, with a ratio of 1 per 100 children globally. So today we are going to discuss in detail regarding causes, clinical pictures, and how to manage the autism child. Previously, autism was known as pervasive developmental disorder, that is PDD. It is a continuum of associated cognitive and neurobehavioral disorder. This means there is a continuous range from mild to severe condition without a clear-cut boundaries. Some may have just a mild learning issues and others may have a severe intellectual disabilities. So this is occurring in autism. So this is also called as a spectrum. And cognitive functions are the problems which are related to thinking, learning, memory, attention, reasoning, and also the problem solving conditions. And when we say neurobehavioral disorders, this is a disorder where brain function is affected in behavior and emotion. So in autism, behavior and emotion is affected. This affects a child's communication, social interaction skill, and the pattern of behavior. These three things are affected in these children. So, to diagnose autistic spectrum disorders, we use DSM-5 criteria, which uses 2 core domains. So, DSM means Diagnostic and Statistical Manual of Mental Disorders, 5th edition. So here 2 core domains are used. Domain A is deficit in social communication and interactions. So all 3 points coming under this should be present in a child to say autism, or child is having autism. So number 1 point is difficulty with reciprocal conversation, and there is delayed or absent language skill. So reciprocal means the child is not having a two-way communication. And then number 2, there is challenges or problem in non-verbal communication. So this means child will not have eye contact, will not have any facial expressions or any gestures, body gestures when the child is expressing the thoughts. So the child will not have any eye contact also. Number 3, there is problems in developing and maintaining relationship with others. So all these 3 points should be present in the number 1 domain, that is social communication and interaction. Number 2 domain is restricted repetitive patterns of behaviors, interest and activities. So out of these 3, at least 2 points should be present. So when we say this restricted repetitive pattern of behaviors, this means the child is very rigid, resistant to any change, and then they want to repeat the same thing again and again. So number 1 point says repetitive motor movements. A child will have repetitive motor movements or speech. So these repetitive movements are not under the voluntary control. So they go on repeating the same motor movement or same speech again and again. And second point is insistence in sameness and inflexible routines. So these children want things to always happen in the same way. They don't want change. So they become very upset by even a minor changes in the pattern. And inflexible routines means extreme need for a routine order. So routinely they do the same things again and again. And number 3 is highly restricted fixated interest they have. So highly restricted fixated interest means they are focused on one thing. So they have a focused interest which is very strong and intense. So sometimes they are very intelligent because they focus so much in one thing. So in that particular thing they will be very, very extremely good also. And number 4, hyper or hyporeactivity to sensory input. So this means the child reacts either too strongly or too weakly to any things, especially like sound, touch, light, smell, taste or movements. So if you light a torch in front of them, they become very sensitive, very scared, they start jumping and then they show reactions. And some children, they do not show any reactions. So either very strongly or too weakly they react to all these things. Now come to the epidemiology. This is the worldwide prevalence. I already told you it is 1 out of 100 children globally. In India, prevalence is 1 out of 65 in 2 to 9 year old children. The cognitive function range from profound mental retardation to above average in the IQ. So there is no borderline. So it is a wide spectrum. Some have very limited features and then some are very disabled. So they may have profound mental retardation, that is intellectual developmental disabilities, to even above average in IQ test. And in milder cases, male to female ratio is 4:1. Male have 4 times higher than the females. And in severe cognitive impairment, male to female ratio is 1.3:1. So males have 1.3 times higher than the females. Now come to the etiology. Etiology is multifactorial. The causes. Number 1 is this condition has genetic predisposition. So in the families you can see, if it is a monozygotic twins, chances of having autism in both these two children will be 60 to 90%. 90%, that is very high. And then reason is mutations occurring in the gene. Number 2 is environmental factors, where pre or perinatal insult to the brain occurs, leading to this autism. So these conditions which may lead to insult to the brain can be prenatally the infections, rubella syndrome, tuberous sclerosis, and postnatally PKU, that is phenylketonuria, infantile spasm, herpes simplex, encephalitis. And very rarely vaccines like MMR can also be responsible for autism. Number 3 point, structural and functional and biochemical abnormalities occurring in the brain. So this is by birth. If they have these deformities, then there is a high chance. Another is advanced parental age. Mother's age, if it is more than 35 to 40 years, and the father's age, if it is more than 40 to 50 years, then there is a high chance this child will have a autism. And prematurity or low birth weight, because chances of brain malformations are high in this group, so that this can be one condition. And then some associated certain syndromes like Fragile X syndrome, Prader-Willi syndrome, Angelman syndrome. All these are chromosomal disorder syndromes where you can see autism. Now come to the clinical features. The clinical features are usually noticed, onset is usually before 3 years. So around 2 to 3 years, the parents, they start noticing this, but it can be diagnosed as early as 18 months. So the routine well baby check is very, very important. So at this time, you can detect the very early features of autism, and you can help and guide the parents to follow the correct place. So these children, number 1 point, they will have lack of eye contact. They will not look at you directly. Another is lack of social or emotional skill. They have no interest in enjoyment or achievements, and they have very poor facial expression, body postures or gestures. So they are just playing alone with themselves. And then there is a delayed or absent language skill. So usually parents come to us because this child is not talking, so the child is not developing language skills. Then the parents come to us, so by the time they come to us, it is already quite late. So other clinical features can be stereotypical body movements. Repeatedly child is doing the same movement again and again. This can be, which is quite severe. So this which is non-stop. So this is one of the clinical features. And there is preference for solitary play. Child is playing alone and then talking by themselves. You cannot understand their language. So by themselves they utter some words and then they prefer to play alone. And older children, they have a severe impairment in socialization. So they cannot interact with the people in the society. And number 7 point, unable to concentrate. These children, they are unable to concentrate or they focus only in one point. And then 1/3 may also develop epilepsy. They may have a seizure disorder. And then very important point is this condition is going to stay lifelong. It is not a curable disease, it stays lifelong. Intelligence is variable. Some have a very high IQ and 75% they may have a mental retardation also. So that mental retardation is intellectual developmental disabilities. And some show isolated remarkable talent with a very good IQ. Now come to diagnosis. For diagnosis, we look at the clinical symptoms which usually presents before 3 years of age. The average age of diagnosis is 3 to 6 years age, but some can be diagnosed even at 18 to 24 months age. This is when they are in touch with the doctors. So if they come for the well baby check, then this time we can diagnose. And usually it remains misdiagnosed because people think this is a hearing deficiency. The child is not developing language, so they think this is a hearing deficiency. So if the child cannot hear, they will play alone, so they don't notice much. Another is learning disabled is there, ADHD. This child, autism is associated with ADHD, so people are more focused on ADHD. And then they might think this is a global delayed milestone, so they do not consult with the doctors many times. It is associated with the seizure disorder, epilepsy, so they are focused on epilepsy, so that condition also diagnosis is delayed. And intellectual disability, anxiety, all these are associated conditions, so they are more focused to these other conditions, and then the diagnosis is delayed. Now come to screening and diagnosis. Diagnosis, it will be according to the DSM-5 criteria I have already discussed above. And then initially we use the screening tools, then only we go for the final diagnosis. So screening instruments for 18 to 24 month age children is standard autism screening tool. And for the toddlers we use MCHAT, that is modified checklist for autism. And for and older than 4 years old children we use pervasive developmental disorder screening test 2, and social communication questionnaires are used. These are all tools to identify the children at risk for autism. So 18 to 24 month, the early diagnosis is by using standard autism screening tool. These tools do not confirm the diagnosis, but it helps to decide if the child needs a further evaluation. So toddlers MCHAT is used. So here they are using a structured questionnaire of yes or no. So 20 points are there. So they ask the caretaker or the parents these questions. There are 20 questions, and then by this screening tool they decide whether this child needs a further evaluation or no, whether they should go for the final diagnosis. Similarly, for more than 4 years, this pervasive developmental disorder screening test 2 and social communications questionnaire, they also have a structured questionnaire for this 4-year-old children. So that way they decide whether they should need a further evaluation. Then they go for final diagnosis for DSM-5. So 18 months above we are using standard autism screening tool, but for children less than 18 months they are so small, so this time the diagnosis is very difficult, but still you can focus on 2 points, that is social communication skill and then this language. So by this you can find out. So for this you need the detailed developmental assessment. So you do the developmental assessment at around 18 months or less than 18 months, and if you suspect if anything is wrong, then you have to follow up this child every 3 months. So every 3 months you'll do the development and assess the social skill and then communication skill and do the screening, and then decide whether you have to take this child for the final diagnosis. So final diagnosis is done by the DSM-5, that is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. This was published by the American Psychiatric Association. So by this I have discussed the points in detail in the previous slides. So by this you have to decide whether this child is having autism or not. So as per DSM-5, independent checklists are also used. So this checklist which comprises of those points, the 2 core criteria I have talked about, so those points it is included in these tools. So number 1 is INCLEN diagnostic tool of ASD is used, which has, and then another is Indian scale for assessment of autism is used. So both of these has those 2 main core criterias. And then other diagnostic instruments are Childhood Autism Rating Scale 2, Autism Diagnostic Interview Revised, Autism Diagnostic Observation Schedule General. So all these are different tools, but they talk about the main 2 core domains of DSM-5. And all these children will have to undergo the hearing evaluation test, because many times a child does not talk when the child cannot hear. So hearing assessment is a very important evaluation or assessment in a case of autism. Okay, now come to treatment. Treatment is by multidisciplinary approach or multidisciplinary team, and always remember there is no cure for autism. It stays lifelong. Early intensive behavioral intervention is very important, and speech and language therapy communication training is given, and then they give a structured education support with a special education to these children. So structured education support is, this is a systematic and individualized teaching method which is tailored to their needs. According to the child's need, it is individualized, and then this is given by a special teacher. And in this structured education they try to use some pictures, symbols, some icons to make the child understand. So along with that you need a parent education. So you have to teach what autism is to the parents, and then teach them how to handle these children. And medication has some role. So these medications are used to decrease the maladaptive behavior, aggression, ADHD and irritability. So for hyperactivity you can use the stimulants like methylphenidate. For maladaptive behavior we use risperidone or haloperidol. And then for rigidity, repetitive behaviors, we use some SSRI, that selective serotonin reuptake inhibitors like fluoxetine, sertraline and citalopram. So all these medications has some role. Sometimes you may have to use these medications so the hyperactivity of the children is less, so it is easier to handle these children, because sometimes it's very difficult to handle these children because of their behaviors. In summary, ASD, that is the autistic spectrum disorder, is characterized by deficit in social communication, repetitive behavior, and lack of interest and activity. So if you are noticing this, you have to always think this child may have autism, and especially if the child is not having eye contact, if the child is not contacting with you, you have to be very careful. And if the child is staying alone, that is important. And IQ usually is normal in many children, but some has mental retardation also. Average age at diagnosis is 3 to 6 years, but always remember it can be diagnosed earlier if you are in touch or in contact with the doctors. Important to screen at 18-month age for the early diagnosis. So even doctors, if children of this age comes, you have to always notice those points in the development and then help the parents or guide them for further evaluation. And most early pointer of autism is delay in verbal, non-verbal communication. So verbal is the language communication, non-verbal will be the eye contact and the gesture, body postures or body gestures of the child. So these things have to be noticed. And management is lifelong, because this is a lifelong condition, and it should always be, the treatment should be individualized, multiple disciplinary approach. For individual child, treatment will be individual and different. Okay, thank you. So remember, autism is not a disease to be cured. It has to be understood, respected and supported. I hope this class was helpful for you. If you think it is helpful, you subscribe, share and please like. Next class I'll come up with the last topic of the neurodevelopmental disorder, that will be habit disorders.